On April 23rd, there were 3,635 confirmed cases of COVID-19 in South Africa from over 133,000 tests done, 1,154 cases in Ghana from over 70,000 tests done, and 873 cases in Nigeria from about 10,000 tests done. Nigeria has a similar number of cases to that in Ghana, although Ghana has done 7 times more testing. This suggests that due to lack of adequate testing, the actual caseload in Nigeria is significantly higher than it has been detected and reported. In South Africa, there had been concerted effort over the last 30 years since the end of apartheid to improve the quality and reach of National Health Laboratory Service. Consequently, it was much more straightforward to establish new test sites and set up sample transport networks from far-flung areas into hub laboratories offering COVID-19 testing. In Ghana, the approach had been to bring the samples from all areas of the country, including the use of drones, for testing at centers of excellence, such as the Noguchi Memorial Institute for Medical Research. This approach, as well as the early start in February 2020, allowed them to move quickly, achieve relatively high testing coverage, and has allowed limited opening of some regions of the country. But however, this approach had some downside. It lacks redundancy, as it puts most eggs in a single basket. And there are also concerns of access of equity for people living far away from this key laboratory, which is located in the Atlantic coast. Senegal is not left out, as they have devised a way to make the testing kits less expensive. Nigeria has neither the long-term investment of South Africa nor the relatively small size of Ghana to allow for the centralization of testing. Thus, the approach in Nigeria was to establish COVID testing in HIV laboratories across the country, and as of April 25th, there are 15 of these testing sites with a capacity to do up to 2,500 tests a day.
Just increasing the numbers of tests that we can do. We also recognize that it was important to redistribute our lab network and to make sure that we had labs across at least 4 to 5 hours vehicular access to the lab across the country. So we went on an aggressive expansion process. Now, realizing that it's the same people, the same scarce people that were building up our lab testing capacity, that also we also needed to activate these labs across the country. So, very tricky situation. Do I keep them here in Abuja and increase the testing capacity in Abuja, or do I send them out to Kano, Kaduna, Jos, Maiduguri to roll out new labs?
But how is this testing done in Nigeria?
What can delay it's the number of samples that are coming in at the same time. So the turnover period now is about 2 to 48 hours. That's 2 days, within 2 days to 3 days.
This approach has been slow and has arguably allowed COVID-19 to take hold in Nigeria, but it will provide good geographic coverage than the centralized approach in Ghana.
We are nowhere near where we should be now. We haven't even done up to 15,000 tests. If we have done 15,000 tests, that means we have just done 15,000 tests. If you compare 15,000 tests to our population, in fact, if you compare 15,000 tests, let's imagine it's all the 15,000 have even been done in Lagos. If you compare it to the population of Lagos, it's nowhere near where we should be, not to talk of the whole of Nigeria. So we need to do more testing.
On the 29th of April, the National Center for Disease Control (NCDC) achieved a milestone in COVID-19 testing that will increase the testing capacity of the agency. An official of the agency disclosed that the agency has begun the usage of COBAT system at the NCDC National Reference Laboratory.
It is all happening live, and we will be watching and learning. COVID-19 is revealing the strengths and weaknesses of our laboratory system in Nigeria. But it is also showing us how to scale up capacity in our laboratory system. Onyechi Ogu, Galaxy TV News, Lagos.